Good morning, colleagues, friends, excellencies, ladies, gentlemen. Good morning and welcome to this virtual meeting and virtual session within the HLPF. Welcome, Ambassador Brian.
Thank you so much, Ambassador.
So this is, I know the HLPF is a very crowded week, like most high-level weeks at the United Nations. We are very pleased we could pull this together at this time, but we are particularly pleased that so many of you continue to show interest in one of the great health challenges of our time, and continue to be very vocal and in supporting our efforts towards making sure that eye health is part of the universal health menu and bringing the attention of governments, the international community to the challenges of eye health and the importance of eye health within the context of universal health and the context of health challenges in our societies. Today we have a panel of experts who would share their thoughts and bring their expertise on the subject to share with us. We will once again deliberate on this and hopefully we'll have time at the end for questions. On the platform, the virtual platform, I will introduce my good friend and co-chair, Ambassador Rabab of Bangladesh, and we also have Ambassador Flynn of Ireland, and Peter of IAPB with us, and of course, Jayathma, the youth coordinator of the Secretary General's youth coordinator. I will begin by introducing and asking Ambassador Rabab to say a few words of welcome and a few opening words to us. Ambassador, you have the floor, please.
Thank you, Ambassador. Eye health is a major global health challenge. The scale of the problem is staggering. More than 2 billion people around the globe are either suffering from blindness or lower vision. 75% of visual impairment is avoidable through cost-effective treatment and prevention. And sadly, 89% of those who are blind live in low-income settings where access to quality eye care is scarce. A grim reality that calls for transformative and urgent actions. Until the end of last year, when the World Vision Report 2019 was published, we knew that the actions under the global initiative, Vision 2020, the right to sight, were on track. However, as with everything else, the COVID-19 pandemic has posed major challenges to this progress. It is critical to ensure that while responding to the pandemic and addressing its impacts, countries keep vision care in focus and hold on to the gains made thus far. Dear friends and colleagues, there are several SDGs, and I know many of you may have heard it again, but let me repeat it for some of you who may be attending it for the first time. There are several SDGs that are related to eye health. For example, Goal 3, health. Poor vision affects the general well-being and impedes the access to care for neglected tropical eye diseases and universal health coverage. Goal 4, education. The corrected vision of a child can increase the half-year equivalent of schooling in a calendar year. Goal 8, productivity can be boosted by about 22%, thus raising possibility of a decent job. Goal 10, reducing inequalities. Thus, by preventing blindness and restoring sight, we can break the cycle of poverty and inequalities, and in the process, helping entire families escape impoverishment, and that is Goal 1. As we enter the final decade for action, vigorous efforts are needed to accelerate progress towards achieving the 2030 agenda. And it is amply evident that investing in vision care would in turn contribute to attaining this range of SDGs. This will help us to build back better in the post-COVID recovery as well. Intergovernmental forums such as the HLPF, dedicated to track SDGs, could provide clear directions on the kind of actions that can be taken to achieve vision care targets. And it was with that objective that we are gathered here today. We firmly believe that there is a critical need for multi-stakeholder engagement and coordinated actions, without which these targets are unlikely to be achieved. Excellencies, dear friends, I'm very happy to share that the Friends of Vision group has made good progress in the past couple of years. With our partners, we have made significant strides in raising awareness among member states and the wider UN community. We played an important role last year at the high-level meeting on UHC, where global leaders promised to make eye care integral to universal health coverage. With a dedicated group of NGOs, IPAP, Fred Hollows Foundation, Clearly, to name just a few, we also organized a successful eye screening event last fall at the UN, and we are pretty determined to expand and extend that in the UN further. These are measurable achievements in terms of raising awareness, but not enough for our ultimate goal to save people from preventable diseases related to vision. Dear friends, global blindness is predicted to triple by 2050 due to the rapidly growing and aging population. So we must find sustainable ways to scale up efforts to create real change. To do that, we need further global recognition for vision care so that there is greater impetus to invest in resources and overcoming barriers to eye care for the vulnerable by leveraging technology and innovation and investing in partnerships. With that objective, we are considering a high-level event during the upcoming 75th UNGA session and the introduction and adoption of the first ever UN resolution on vision health. Ambassador Webson will elaborate further on that in due course. So far, we have received very good response from member states and UN agencies to these ideas, and we are pretty hopeful about making a breakthrough on this. On our part, we remain determined to continue our efforts to mobilize and secure broad-based support of all member states. Dear friends, I would like to conclude by saying that it is time that we change the way the world sees vision care. It is time that we act on our commitments. I thank you once again for joining us this morning, and I look forward to hearing your views and ideas on how we can proceed further towards reaching our goal. I thank you. I thank you, Ambassador.
Thank you, Ambassador Rabai, and for your very powerful and very encouraging words. Indeed, friends, excellencies, we are appreciative and feel that we are making progress with the number of countries and member states that have joined the Friends of Vision. Indeed, we believe that we are beginning to bring to the attention of the community, the global community, the importance of eye health within the context of the SDGs. If we fail to address eye health within the context of the global achievement of leaving, global promise of leaving no one behind, we would have failed to address and complete the SDGs. It is intrinsically linked to many of the SDGs, as pointed out by my good friend, Ambassador Rabab. We clearly must increase the attention. We clearly must bring to the community the importance of eye health within the context of the delivery of universal health. We will speak towards the end about the resolution to which the ambassador made reference and the September meeting, high-level meeting, to which the ambassador made reference. But for now, let me introduce another colleague who is new to the eye health and the Friends of Vision, but someone who represents a community that is significantly important within the process of healthcare and eye health services, youths. We cannot advance the causes of humanity without taking foremost the challenges of our youth. We cannot address the questions of eye health today without addressing the questions of eye health within the youth and young population of our societies. For it is those members of our community, our global community, who will lead us. It is those members who will ensure that there is a global future. Jayanthia is the Secretary General's Youth Envoy, and I now give her the floor. And she, unfortunately, I am told, have to leave early, but I will give her the floor now so that she can bring us her words of wisdom. Jayanthia, it's over to you, please.
Thank you very much, Ambassador Webson. Excellencies, esteemed colleagues, wherever you are, good morning, good afternoon, good evening. I hope that you are safe and healthy and that you are taking care of yourself and those around you. First, let me thank the three co-chairs of the UN Friends of Vision Group, the Permanent Mission of Antigua and Barbuda, the Mission of Bangladesh, and the Mission of Ireland for inviting me to speak at this event and for giving me the opportunity to contribute to this important discussion, as Ambassador said, as it relates to young persons and their eye health. I will try to particularly focus on young people living with disabilities and visual disabilities in my intervention today. Due to their age and transition period from childhood to adulthood, youth populations face unique challenges in this period of their lives. And this can be exacerbated, these challenges can be exacerbated if they're going through a period of transition where they are not really able to comprehend what is happening around, for an example, uncertain times like COVID-19 right now. Despite the fact that globally almost 180 million young people between the ages of 10 to 24 live with a physical, sensory, intellectual, or mental health disability significant enough to make a difference in their daily lives, they are a continuously overlooked group in all international development policies and programming. So I applaud the Friends of Vision initiative for allowing much needed conversations focused on these issues, but most oftenly also taking the time to focus on the youth demography and youth population. As the ambassador of Bangladesh said, also large population of youth, actually 90% of the youth population in the world today live in developing and least developed countries. These conversations like today are a great example of an approach that puts the social and human rights-based perspective in the center of efforts to safeguarding the health and well-being, particularly for persons living with disabilities, especially in a time like COVID-19. While it's important to support visually impaired individuals from a medical model perspective, it is equally important to consider the social and human rights lens of how COVID-19 has affected their lives. This approach embraces the diversity of individual needs, recognizes the challenges, and provides evidence for adaptation of guidelines and protocols which best apply to people considering the environment that they live in. Because this is not my lived experience and because I'm not an expert in this particular field, I often receive feedback and I try to consult young people going through vision challenges. There have been, according to them, situations where their access to crucial information regarding COVID-19 prevention and response was compromised due to inaccessibility of the platforms and tools carrying this information. Things such as websites, videos, or even televised broadcast. They also shared with me that there are numerous accounts of stereotypes and biases towards them, which lead to denial of their fundamental rights, such as access to equal health care in some countries. Online education has made it more challenging for visually impaired young people due to inaccessible digital content interfaces as such. In-person support that they once used to get and once had access to compensate for inaccessible infrastructure, both physical and digital, has now been put hold because of COVID-19. And due to physical distancing measures, assistance in daily activities has decreased, leading to confinement in their own homes, isolation, or loneliness sometimes, which in turn affect the mental well-being of them. These young people also shared with me that, for instance, universal enforcement of wearing a mask to contain the spread of coronavirus, for an example, may hinder the vision for partially sighted persons who need to use their vision for mobility. Therefore, in order to support young people tackling these issues, some proactive steps towards an inclusive and rights-based approach, particularly in the COVID-19 response and recovery, would include ensuring training and awareness of medical personnel, community workers, and even community members on appropriate prevention measures, care, and support for young people going through vision challenges, ensuring accessibility to textbooks, books, IEC materials with a longer-term commitment to the ratification of the Marrakesh Treaty, ensuring that all information delivered by national and international authorities on crises like COVID-19 are accessible to all, such as accessible Word formats, accessible EPUB, PDFs, rather than scanned versions of material that we sometimes see, proactively ensuring the inclusion of and accessibility of all young persons are mainstreamed in all our policies, programs, and activities. As we begin the decade of action for achieving the SDGs by 2030, and in the context of COVID-19 response and recovery plans put in place, the specific needs, circumstances, and capacities of young persons must be fully included in our policies and programs, building a truly inclusive new normal where no young person is left behind. Thank you very much again for having me and giving me this opportunity, Ambassador.
Thank you very much, Anthea, for your words and guidance with regards to the challenges of eye health amongst the youth population. When we address the question of eye health, we speak of the questions of health in the context of prevention, as well as eye health in the context of eye care or rehabilitation. Needs for glasses, needs for eye services, needs for in an environment that would support the person with low vision or partial vision, which allows us to support the kind of eye care services that those individuals require. We speak of glasses for all kids. We speak of eye care and access to eye care services for all children and all people. So the eye health arena, if you might, encompasses a broad array of services once we see it within the context of health and universal health, and not just as an isolation. I am challenged within a particular health corner. So, and we're pleased that you were able to link that. So thank you very much again. I will, we have with us the Executive Director of the International Agency of the Prevention of Blindness, Peter Holland, and Peter is a colleague and friend that we have been working with in this, and his agency has been very generous in providing support to the Friends of Vision in guiding us along the way with the technical information and helping to bring people together, such as we are doing on this platform. Peter will chair us through, he will introduce the panel and will guide us through the process as we listen to the speakers. And I will come back with information towards the end of the program with some closing remarks. Peter, we are very pleased to have you. We thank you and your team and the other members of the civil society and NGO community who has provided support to the Friends of Vision in helping us to put this together and helping us to be able to advance the cause of eye health within the context of the work that we do here in New York, and including linking us with the work in Geneva, so that we can ensure that there is global attention to the subject that we are addressing. Thank you and your team again, and the members of the community, civil society who are working with us. Peter, I would like to introduce you to take us through the program, please. You have the floor, Peter. Thank you.
Thank you very much, Ambassador Webson. Indeed, thank you. For those who don't know IAPB, we're the overarching alliance for the global eye care sector. So we have about 150 members worldwide, drawn from NGOs, private sector, corporate sector, academic institutions, eye hospitals, and professional bodies. And as Ambassador Webson has said, we're working with a number of our members, foundations, and groups representing the private sector and have been providing support to Friends of Vision. We will use the Q&A function. If you would like to ask a question of the panel, who I'll introduce shortly, it would be really helpful if you could signal that through the Q&A function at the bottom of your screen. If you can write a question in and your name and affiliation, that would be very helpful. We will try to give you the opportunity to ask the question directly, but it would be helpful to know for you to signal that in advance. Just before we turn to the panel, I'd like in return to thank Ambassador Webson and his team for his leadership over the past 2 years, because really in less than 2 years, we've gone from an idea that was discussed over lunch to what is a really fully fledged, obviously, UN Friends of Vision group with a really ambitious agenda, growing participation and momentum. And obviously it's fantastic as well to have the co-chairs of the permanent representatives from Bangladesh and Ireland, which I think reflects the salience and the importance of the issue. And I think from the perspective of the sector, it's really important to have this issue on the agenda here at the UN because of the critical relationship, as we've heard already, between eye health and good quality eye care and the delivery of the Sustainable Development Goals. So I'm delighted to introduce our panel today to really talk about these issues, and also in particular the impact that COVID-19 has been having on eye health and the delivery of what we're trying to achieve. So firstly, we have Amanda Huang, who's the cluster lead for China, Vietnam, Cambodia, Laos, and Myanmar at the Fred Hollows Foundation. Amanda has more than 17 years experience in international development sectors in China, with a particular focus on children's welfare, community development, and eye health. Then we've got Dr. Ciku Mathenge, who's an ophthalmologist with the Rwanda International Institute of Ophthalmology. She's a leader in eye care in Africa, both in clinical care and in research. And she was awarded the first Sir John Wilson Fellowship by the British Council for Prevention of Blindness. She's also the author of the WHO Africa's Primary Eye Care Training Manual. And thirdly, we've got Dr. Silvio Mariotti, who's also an ophthalmologist and the Senior Medical Officer from the World Health Organization. And he's a co-author of the World Health Organization's World Report on Vision, which was published last year. So to kick off for questions to the panel, I'd like to invite Ambassador Brian Flynn, the Deputy Permanent Representative from Ireland, to ask the first question. Ambassador Flynn.
Thank you, Peter, and great to be here, great to join you all. It looks like a great lineup of panelists, so looking forward to hearing from them. Ireland is honoured to co-chair the group of Friends of Vision with Antigua and Barbuda and Bangladesh, and I join others in paying particular tribute to Ambassador Webson's leadership on this issue. I think the very strong turnout we see here this morning speaks to eye health for so many, with upwards of 2.2 billion people living with vision impairment worldwide. As has been said already this morning and many times, if we're really truly committed to addressing the root causes of poverty and inequality and progressing all of the SDGs, we simply have to scale up eye care globally. This is not only important for the achievement of SDG 4, but it's also crucial for a range of other SDGs like gender equality, education, and decent work. We know that, for instance, as Ambassador Fatima said earlier, the wearing of glasses is equivalent to up to an additional half year of schooling. Impaired vision is also a cause of up to 60% of road traffic accidents, and we heard earlier as well about the economic impact. The World Report on Vision from 2019 warns us that without concerted action by 2050, 3 times as many people will be blind as now. I suppose in terms of my question, we know that the challenges arising from COVID are increasing all of these particular challenges that people with vision impairment face. We have seen widespread interruption in access to essential health services for the poorest and most vulnerable, and we are faced with a situation where inequalities are deepening. So my question relates to how eye health can act as a catalyst for the achievement of the SDGs as we focus on building back better in the COVID response and recovery. What has been the impact on eye health so far, and where should efforts now be focused to ensure eye care is not left behind as countries reassess the delivery of essential healthcare services, education, and poverty eradication initiatives? Thank you, Peter.
Thank you very much, Ambassador Flynn. And Silvio, perhaps I can turn to you first for your assessment from a WHO perspective.
Thank you, Peter, and allow me as well to thank the chairs and co-chairs of this panel to invite WHO to be part of this great initiative, be among the Friends of Vision. Of course, just mentioned before, the COVID pandemic brought most services to an halt. From a provider perspective, suspended examinations, suspended surgeries or delayed surgeries are less urgent. Complete halt of high volume screening and services and surgeries. Closing department, closing offices, closing shops has brought the people in need of eye care to be in a suspended status. From the patient perspective, it has been even worse, possibly because from information we gather from our friends around the world and collaborating centers, the first thing for patients was that they felt abandoned. They were locked in many countries without access to medications, and then falling in the depressive status of fearing that their sight and their vision was gone away because of lack of access to medication, of examinations, and the immediate fear of losing sight because of all these social distances and isolation. And this was particularly important for people suffering from very severe chronic diseases like glaucoma, retinopathy, AMD, dry eyes. These are the big killers of vision around the world, the big enemies we have. Children perspective, just mentioned before, retinopathy of prematurity services, congenital cataract services, amblyopia. These may really have an impact in the long life follow-up for many of these people. So very serious from our perspective. People who were undergoing rehabilitation, all services were suspended with the risk of losing all the advances, all the achievement they had. And we have to remember that during the social distancing recommendations, people who suffer from, people who are blind or suffering from low vision have particular challenges because they cannot really verify whether there is social distancing around them, and they need to touch the things that they need in order to recognize whether they're the right or not. So exposing themselves more than others to risk of contagion. From a system perspective, many services have to be delayed, closed down, so running into risk of financial sustainability. Boost communication, which was not always possible, particularly in low-income settings. And also reduce the volume of services and increase costs for those services which of course can really risk the long-term existence of those services. So for us, during COVID and post-COVID situation has been very, very serious. WHO has been working with all those who reach out to us for help. We have been participating to issuing recommendations through the professional association, how to continue safely delivering services during COVID and after COVID. Of course, there is an impact, and we've been working actively with member states who ask our support to limit those effects and avoid that there is a long-term impact on patients, which remain at the core of our services and work. And I will stop here and eventually take the floor again later on. Thank you, Peter.
Thank you, Silvio. Ciku, perhaps I could turn to you for your perspective.
Okay. I think several questions were asked, so I will not attempt to answer all of them in one go, but The first question was about eye health being a catalyst in this decade. And I think that this decade is about unlocking human potential, and it's about well-being throughout life. And eye health is such a key component of that we do have to give the maximum vision that we can give to people, or give the maximum rehabilitation that we can to those with visual impairment. Ambassador Webson was just talking about how he's surrounded by gadgets today, and that's about unlocking human potential, and eye health really has to be part of that. In terms of the impact on eye health delivery in country where I come from, I'm talking to you from Rwanda. There has been major impact. So lockdown and travel restrictions meant that patients couldn't travel for care. Just before we went on total lockdown in March, I ran a retina clinic, and I didn't see those patients until June. And some of them remained stable, but a lot of those who had diabetic retinopathy did get much worse, and they just couldn't get to care. The other thing in Rwanda is that a huge proportion of cataract surgery in this country is done when surgeons visit district hospitals that don't have ophthalmologists. And for example, last year, 50% of cataract surgery was done that way. But because of the lockdowns, we were unable to travel to those sites, and patients were also unable to travel to the surgical sites. And that has had major impact on the cataract rate in this country. Thank you.
Great. Thank you very much, Ciku. And Amanda.
Thank you, Peter, and thank you, ambassadors, for the opportunity to share some perspective from social societies. Regarding the first question, eye health acted as a catalyst for decade of action. First of all, I think eye care is really interlinked with both individual and the overall social development. And without eye health for all, we will not be able to achieve the global goal in the next decade. And we also know there are disparities in the availability and access to eye care, both within and also across countries. And we know that closing the gaps in eye care around the world will also have great impact on people's ability to get education, and women being empowered to work, lifting people out of poverty and so much. So it's really demonstrate how interlinked eye health is in helping accelerate the action and giving a word of achieving SDG goals. And regarding the COVID impact, for example, in China, we had the first outbreak early this year, and a majority of eye care, both eye care and other medical efforts across the country has been redirected to respond to COVID. Also including a lot of trained medical staff, ophthalmologists, and nurses from our project. They have been sent to support the mission in Hubei province, where it's mostly hit by the pandemic in China, to support local medical relief work. And also at the same time, across the country, most of the hospitals only maintain the emergency service, which caused a huge inconvenience and delay of treatment for people who need ongoing care, eye care services, particularly for our project beneficiaries who's living in rural, remote areas. And some of them, they are really struggled from limited resources. And for example, people with diabetic retinopathy who needs ongoing service, they could only wait because of the lockdown. And some of them, they are even struggle from the lack of essential medicine in rural communities. And till now, still we are only be able to implement activities which can be integrated into regular hospital service. Most of our outreach activities which require large-scale people gathering, it's still not allowed. And in the meantime, I think COVID really reshaped the way how we work and deliver eye health activities. Technology now is playing a growing role in our program on the ground. For example, a great number of our traditional activities has been converted into virtual format. We're doing more and more online activities with the frontline health workers. And it's also fortunately to see there are more and more integrations and united actions being between eye health and general health due to the impact of COVID. Thank you.
Great. Well, thank you very much. And I think that's given quite a vivid description of some of the challenges that have been faced really around the world. We've got a number of people who've signaled that they would be interested in asking questions. So I'm going to take a couple before going back to the panel. So perhaps I could first turn to Ambassador Loreen Bannis-Roberts, the permanent representative of Dominica.
Good morning to Ambassador Webson. Good morning to the panelists. Good morning, everybody. I'm going to be short though, but I have a question, comment. In terms of eye health, what is the plan going forward for early detection, prevention, and treatment? And I say this against the backdrop. If I'm to equate that with, for example, vaccinations, there are some vaccinations that are compulsory. And as a mother, having had 3 babies, you had what was called a health card. And to attend school, to migrate, there are certain vaccinations that the children must have had. I think eye care and the whole issue of vision is so critical that it should form part of a health card, in that it should be stipulated that by a certain age, a child should have had this particular eye test. And it should be ongoing. So from 0 to 5, you should have had an eye test. From between 5 and 10, another one. So let's say every 5 years, a child should have had or must have a vision test to be accepted in a school, to be accepted in certain programs, because I believe early detection and treatment is the key. A stitch in time saves 9. In the Commonwealth of Dominica recently, we had a pilot project where we went to the primary schools and tested the vision of all the children. And it was shocking when it was revealed the percentage of students who needed to wear glasses, who needed eye treatment, and the parents and the teachers were not aware that these children had some impaired vision. And that spoke to their performance at schools. So with vision, because it is an all-encompassing area of the well-being of the human being, we have to take it more seriously. And as I said, there should be mandatory testing in the communities as part of the school curriculum for the health of our children, because vision impacts on so many other aspects of how a human being lives. It could determine whether you live a life of poverty or a life where you can make a meaningful contribution to society. So I think we have our work cut out for us, and we should push for early testing, compulsory testing, for treatment, especially for less for the less fortunate. It should not be something that a parent would have to support and afford. It should be made affordable. It should be part of the education system, part of our communities, part of our country policies, that this must be done because so much depends on the health of the eye. And education, remember, is a way out of poverty. So if we have people who can't read properly, who can't see properly, that will have rippling effects and can even impact seriously on our economies. So my question to you is, how can we find a way to get government, civil society, and everybody to make early testing part of national policies? And it has to be vision for all, no one left behind. That's my contribution this morning.
Thank you very much indeed. Just before I turn to the panel, perhaps I could turn to the Chargé d'Affaires for Haiti, Patrick Saint-Hilaire.
Thank you so much. I'd extend my warmest congratulations to the group of Friends of Vision, in particular to the co-chairs for organizing this virtual session within the framework of the high-level political forum for sustainable development. Ambassador Webson is doing a very commendable job on this issue, among others. Many thanks to the distinguished panelists for their guidance. It's about drawing everyone's attention on to eye health, one of the greatest challenges at this time of global health crisis. It's about highlighting everyone's attention to a reality that we look at every day without perhaps seeing it enough. This is the reality of visually impaired and people with blindness. So it is important to increase attention on the importance of eye health, particularly in the context of the response to COVID-19. Prevention of blindness and access to eye care are challenging for the most vulnerable populations. So it is important to give particular attention to this issue. We can see that a great percentage of the visually impaired and visually impaired people live in developing countries. Haiti has a high number of visually impaired people. Statistics show 100,000 or 1% of the population. Unoperated cataracts and glaucoma are the main causes of the visual impairment in Haiti. So we all know that the daily lives of the visually impaired are particularly challenging. These challenges are exacerbated when there are not adequate measures to facilitate access to public transport technologies, in particular to information. In the vast majority of cases, the environment remains unsuitable for their needs. So my delegation welcomes the decisive economic, health, and social measures and action that have been taken by the international community in response to the COVID-19 pandemic. However, it calls on the international community to do more to promote awareness, respect, and defend the rights of people with visual impairment. Because it is important to create a suitable post-COVID-19 environment that is more inclusive. Because to reach the Sustainable Development Goals by 2030 and not leave anyone behind, a systematic approach is necessary. Active participation and the needs of everyone must be taken into consideration. Thank you for your kind attention.
Thank you very much. Perhaps I could turn to Ciku first to respond to both questions, but particularly, I guess, the question around vision screening, because I know Rwanda has experience on this.
Yes, thank you very much, Peter. And the suggestions from Dominica are excellent. I think exactly putting specific compulsory milestones along the life course of individuals would go a long way in ensuring that people are getting their eyes tested and getting the interventions that are needed. And some of these are policy dependent. So where there are policies, for example, that children should have medical reports before joining specific stages of education, that helps. So if it was compulsory that before a child joins kindergarten, he produces a certificate of health, which includes eye health, another one before joining elementary school, another one before joining secondary school and university. Those would be good milestones that would help us track people's eye health. Other policies are things like eye tests for driving licenses. You'd be surprised how many countries do not have a policy about testing vision in a very objective way for drivers, either when they get their first driving license or even later when they renew their licenses. I think such simple policies would really help in supporting eye health. And school screening is a great activity because, as the ambassador said, a lot of times parents are unaware, the children are unaware because that's the only vision they've ever had. So they assume that's what normal vision is like, and many parents are unaware. So specific school vision screening programs go a long way. The key is that they should not be skewed towards one intervention. They should not be just for dishing out glasses, but that every child should get the type of intervention that they need. And whether it's a surgical intervention, whether it's eye drops, the program needs to be all inclusive. But I think these have been really great suggestions, both from Haiti and Dominica. And like in my country, like Haiti, cataract, glaucoma are the leading causes of blindness, and these are related to aging. So perhaps policies around eye checkups for everybody over the age of 50. For example, when people go to get their first pair of reading glasses, they should not just get reading glasses. It would be excellent if they could get a full eye examination at that time. That would help detect cataracts and detect glaucoma. Yeah, so those are my few comments.
Brilliant. Thank you very much, Ciku. In the interest of time, I'm going to take a couple more questions and perhaps come back to other members of the panel. So firstly, I wonder if I could turn to Mohammad Koba, the Ambassador Mohammad Koba, the Deputy Permanent Representative of Indonesia. Ambassador Koba.
Thank you. Thank you, moderator. And thank you for all the presentations. Vision impairment and eye condition are global issues, and most of the time, these conditions are preventable and treatable. The WHO estimated there are more than 1 billion people living with such conditions because of the lack of access to the treatment and the care that they need. This is why my delegation highly value today's discussion. I would like to reiterate that the improvement of vision is one of the key priorities of Indonesia's health sector. My question is, with the COVID-19 and the increasing trend of people, including children and our youth, using electronic devices and gadgets, how should we modify our campaign and strategy for the eye health? Thank you.
Great, thank you very much. And perhaps I can then turn to Ambassador Cheikh Niang, the Permanent Representative of Senegal. Ambassador Niang.
Thank you very much. I asked my question by writing, but since I have the floor, my question is that we have international conventions for the rights of the disabled people. I just wanted to know at the national level, I'm sure that there are some countries which are lagging behind. And what steps are taken or do you envisage to take to compel those countries or to invite them to really confirm the provisions of those conventions. That's my question. Thank you.
Great, thank you very much. So perhaps I could turn to Silvio first to potentially address both questions, but I guess particularly Ambassador Koba's question about how we adjust our plans in the light of COVID-19.
Thank you, Peter, and I would like to thank the ambassadors for the very pertinent questions. What was clear during COVID-19 because of the lockdown and because of the interruption of services, and as Ciku mentioned before, for some patients, the time spent in isolation could have been too much for saving sight, particularly in some conditions which require continuous and ongoing care. As highlighted what the report shares in terms of the need to incorporate, to integrate primary eye care services in the primary healthcare services. This is not a new idea, a new strategy. This started in the late 80s, but yet we have to achieve the level of completion of this integration. This integration of bringing primary care to the primary healthcare sector and service would also respond to the question of previous ambassadors from Dominica Republic and Haiti, saying how can we advance prevention? How can we identify as early as possible any threat to vision for children, which will protect their sight all across life? So we need to focus on bringing and securing that eye care is available as primary eye care at the primary healthcare level, and this is one of the recommendations we had in our report. This can only be achieved with political leadership. So all those participating to these members are the one who can really make this a reality by bringing these issues to the tables where they are and they are engaged in, where they lead. Because of course, this is a national achievement. Almost all the member states of WHO have in the past identified primary eye care as the best tool and best strategy to ensure that all people, all citizens enjoy protection and prevention measures. Yet this has to become a reality. And I think that through the efforts of the Friend of Vision, through the idea of bringing this to the level of the UN general discussion, that would be another chance, a strong chance to move this and make it a reality. COVID-19 showed us that local services could resume much earlier than distant services. We have information that in many places, even during lockdown, eye care services could continue because the pandemic was not hitting countries uniformly, and the places where the pandemic was not strong, eye care services could continue as long as they were present. So relying only on capital cities, on tertiary care, on long referrals, which happen unfortunately in many low-income countries, was not a way to secure that people could profit and benefit from eye care services where they live. So we have even a demonstration now because of this accident happened around the world, how local services need to include eye care. And everybody said how eye care contributes to global health, global development, education. And I would like also to stress, to complement what Ciku said before, out of 194 member states of WHO, 80% of them do not require vision to be checked after a road accident. Assumption of alcohol, drugs, speed, status of vehicle, road conditions are checked, but vision is not checked. And vision is one of the most important safety features while driving for self and for the people on the road. This unfortunately is not yet something which is stable. In many police reports we've been assessing, all of them, vision is simply not existent. All other factors and variables are included, but vision is not, which to me is one of the things that highlights that unfortunately vision stayed invisible, bizarre as it says, as a contributor to global health. And I believe that we have here the panel and the strength and the force that can lead us to achieve what we've all been advocating for. Thank you, Peter.
Thank you, Silvio. And Amanda, perhaps I could turn to you for a response around the question around the implementation impact of the Convention of Rights of Persons with Disability, particularly at the country level.
Thank you, Peter, for the question. Well, I just wanted to, I think it's important also to emphasize closing the equity gap for eye health, particularly during COVID, because of COVID impact. People who has been hit most are, for example, women, girls, elderly, poor community, and also people with disabilities. And it's important to closing those gender gaps, reducing out-of-pocket payment for the poor, and ensure everyone can access safe and high-quality eye care services. To call out, I think in for COVID recovery and build back better, we really need fairer and more equitable, more sustainable outcome to ensure these unmet needs to be prioritized. Thank you.
Thank you very much. So I think we have just time for one more round of questions. So firstly, I'd like to call on Ambassador Courtney Nemroff, the USA's ECOSOC representative, who I think has a question. Ambassador Nemroff.
Thank you so much to the Mr. Chair, and thank you to the ambassadors of Antigua and Barbuda, Bangladesh and Ireland, and to all the panelists for your excellent insights and recommendations. We're proud to be a member of both the group of friends on disability and the Accessibility Steering Committee here at the UN. And this meeting taking place this week is especially auspicious as we celebrate the one-year anniversary of Security Council Resolution 2475. It's also a particularly important month for the United States as well, because our delegation is celebrating the 30-year anniversary of the landmark Americans with Disabilities Act, and that anniversary is on the 26th. As we address the ongoing pandemic, it's critical that people with disabilities are included in all of the stages of decision making. This is critical to address many of the concerns and problems that have been raised by our panelists today. And we are also proud in this regard to have signed the joint statement issued in response to the Secretary General's policy brief on this issue. I had one question for the panelists, which is, as we look forward to socioeconomic recovery from COVID, what are your thoughts on key measures that delegations can take now collectively at the UN and at the national level to make sure that people with disabilities, all people, as we recover from COVID, recover more strongly? Thank you.
Thank you very much, Ambassador. And finally, could I perhaps turn to the youth representative for Georgia, Esma Gumbaritsa.
Okay, thank you very much for giving me the floor after all the excellencies have spoken. Good morning and good afternoon to everyone. Thank you all for organizing this event. I would also like to applaud the Youth Envoy for bringing up the points of social and human rights-based models when we approach disability, and vision disability included, of course. The right to best attainable standard of health is one of the rights enshrined in the UN CRPD, the Convention on the Rights of Persons with Disabilities. And this is one reason why, one of the many reasons why it's crucial. From my personal experience, a few of my schoolmates, as I have graduated from specialized school for the blind, do have preventable diseases or diseases that, given supportive treatment, could be less regressive, and these people could be sustaining their vision and not losing it constantly. However, we also have to think about the social aspects of those who do live with no vision, with blindness, and with partial vision, as they are students, as they are employees, they are activists in their communities, and they, as the Youth Envoy has mentioned, need participation, need accessibility of websites, of books, of textbooks at universities, in which I think ratification of Marrakesh Treaty for all the member states is one of the key roles, as the UNCRPD committee really insists on ratification of that convention as one of the many instruments of CRPD rights implementation. I would also, as we are young people and we face certain challenges and barriers, both due to our age as we're transitioning from work to study, but also due to our disabilities. We have certain added up vulnerabilities, and the intersectional approach thus is very important, which I actually have emphasized in my personal statement on the 74th General Assembly, 3rd Committee. So my question to the delegations would be, how should the states, the member states, promote participation of young people with disabilities on both national and international level? We know that up to 15% of the global population are people with disabilities, and this amount, of course, may increase in countries that have experienced war and armed conflict. Therefore, young people with disabilities are also an important group and part of this bigger minority, as well as of 1 billion young people. Thank you so much.
Thank you very much. So perhaps if I can go around the panel quickly in turn. I think both questions are very much about ensuring that recovery is that there is an inclusive recovery, and obviously with a perspective from the last questioner on engaging youth as well. So Chico, perhaps I could turn to you first.
Okay, so what we've seen is that, you know, the COVID tragedy has been a double tragedy for people with poor vision. So I really appreciate the comments of the two speakers. I think this is the time to have targeted responses, positive discrimination in terms of policy for people with poor vision. One of the other things we've seen during this period is that we've come to appreciate local resources and local solutions, and that momentum should be strengthened and built on. So for example, countries have learned how to make their own masks and their own PPEs. That was a lesson that we could be able to make the surgical gowns and the surgical drapes that previously we've been importing at great cost. So as part of recovery, we should encourage and build on these solutions that we've been forced to embrace because of COVID. I'd also say that eye health is actually quite an organized field, and it has a lot of resources and strengths. And as part of recovery, these resources could help the COVID response. This includes things like all the vehicles that were being used for outreach. They could be put at the disposal of COVID programs. We could avert some of these strengths towards the COVID response, and we should integrate education on COVID into our normal eye health promotion messages. As part of the local solutions, there are still countries that do not have, for example, low vision services or rehabilitation services. At least in my region, it's really hard to get devices for young people who are still in school and who need to learn how to go on with their lives ahead. And I think policies around ensuring that each country does have some form of rehabilitation and low vision services would be really useful. Thank you, Peter.
Thank you very much, Ciku. And Amanda.
Thank you, Peter. Well, I think in two ways we can better support the inclusion of disability and also other needs from the learning of COVID. First of all, I think in general, we need better coordination across different policy sectors at all levels of government. And I see SDG could be a central framework to guide this coordination. And health and also inclusive health could be an integral part of all policy-making process. And in terms of eye health, it has to be an essential part of all public health agendas in all countries, because eye health is so interlinked with the overall social development, including economic growth, better education, and social productivity. And also, I would encourage to have more community participation, peer supporting, and also empower the community to look after each other. Because from COVID, we see there are a lot of community volunteers. They are actively supporting the community to respond to the COVID needs, particularly for people with disabilities and special needs during this pandemic. Thank you, Peter.
Thank you very much, Amanda. And finally, Silvio.
Thank you, Peter. And of course, I do agree with what my previous panelist just said. I would like to address an aspect of the question from Ambassador Nevrov, which is very interesting. How can, in the prospect of economic recovery after COVID, how can we ensure that people living with vision disabilities are not neglected or left behind? I think it would be very important, for example, to use parameters like establishment of accessibility variables within every industry, shop, public service, hospital. As an example, I mean, for example, the availability and presence of tactile pathways on the floors of public institutions and services. And the American Disability Act as a very detailed guideline on these will be something very important. Investment also covered those implementation, because policies are fantastic as long as they're implemented. And I believe that giving accessibility, as mentioned before, ensuring that information is available also for those who are vision impaired, so in an accessible format, ensuring that whatever is produced also is an equivalent in Braille language, which is widely used and taught across schools for people with vision impairment and blind in particular. Accessibility and availability of low vision devices, possibly including them the list of those items which do not have to pay import duties or taxes. These are very, very practical, very simple and very effective ways to ensure that in the economy boost many countries are putting forward for sustained economy recovery after COVID, people needing those supports are not left behind or forgotten. And conscious of time, I stop there, but I would like to thank you, all the panelists, for being so deep into the concerns that we all have for people living with disabilities, and also asking them not to forget these whenever they are in panels and discussions, whatever latitude these might take. People with vision impairment or prevention of the same are not forgotten. And let me also share a memory of our colleague Li Wenliang, who was the ophthalmologist who discovered the COVID epidemics and unfortunately died out of the same. Thank you, Peter.
Silvio, thank you very much. And I'd like to add my thanks to the panel, Amanda, Ciku and Silvio, for I think such a perceptive discussion. And thank you for your questions as well. So I'll now hand back Ambassador Webson.
Thank you, Peter. I'd like to first of all thank the members of the panel for their contribution and the tremendous insight and the knowledge shared. I think this morning's meeting, we once again learned a lot in advance and in helping to advance the concerns and advance the need for eye health to be seen as a major challenge and to be placed within the context of any of our discussions on the SDGs and discussions on health services, universal health, etc. Out of this morning's discussion, there are a few things I want to draw. Let me first of all, Silvio, it's the Commonwealth of Dominica, not the Dominican Republic, and I thought I should say that in apology to my colleague from Dominica. It's the Commonwealth of Dominica, and who raised the question. So thank you very much for responding to that question. On that point, however, I think as we discuss the resolution, which is being currently discussed amongst the experts at the UN, the question of primary eye care and the question of the inclusiveness of eye health within the context of the health card or health acceptance before entering schools and various steps along life's journey is a significant and important point, and maybe something we can consider in the discussion inclusive of the primary healthcare context and how eye health should be seen within that context. I do think it's worth being put on the table for discussion within the resolution, so we might want to think about that. Within the context of low vision and rehabilitation services, as we think of eye health services and we think of all of the preventable causes, when we think of care, we do want to include the concept of low vision services within the eye. As we talk of glasses, there are other forms of eye support within the context of eye care, and we might wish to look at that and ensure in our training the concept of low vision using technology to advance vision within education, within work, within play might be something to be considered within the discussion and within the practical responses. Silvio spoke of access, another area as we think of access to information and how people with low vision and no vision at all, people who are blind, access information. So within, again, the context of eye health, looking at access is another area for us to consider within the care component of eye health services. I think we have raised a number of important issues. I again want to thank you all for your attendance. I want to thank you for coming. I want to close by standing again in solidarity with families and with peoples of different states who have succumbed to the pandemic. We recall, we recognize many outstanding friends, family, and citizens of our countries who have passed away due to this pandemic. And we want to express our condolences to the families and to the friends of those who succumbed. We want to stand in solidarity with the countries that are still facing the challenge of this pandemic, and to assure you of all our prayers and our continued thoughts in lifting you and your peoples up. I want to thank all of you for your attendance here today. We're very pleased that we're able to put this on. We look forward to having a similar event, a high-level event in September. We look forward to informing you of in September, October, there will be a report, there will be a major document on the state of world condition of eye health to be put out through the Lancet magazine with collaboration of doctors and personnel and so on in this field through in collaboration with the London School of Hygiene and Matthew Burton and his team who have pulled this together, and we shall look forward to seeing that in later this year. And also we will keep you informed on the resolution that we will put forward to the General Assembly, and we look forward for you getting that later this year. Again, thank you so much, and we apologize for going a little bit over time, but it's been a really delightful and learning experience. Thank you. The meeting is adjourned. Thank you, Peter. Thank you, panelists.